Hello, welcome to my frequently asked questions. Today I'm answering questions about deep plane facelift. What are the frequently asked questions regarding this procedure? Well, in essence, there's 7 main questions that patients ask me. What is a deep plane facelift? Is it better than another type of facelift? Am I a good candidate for this kind of procedure? How long does it take? What is the recovery? What is the cost? And ultimately, what are the potential issues? Am I going to have pain? So we're going to go talk through each one of these in turn. Myself, I'm a facial cosmetic and plastic surgeon based in London. I specialize only in the face, and facelifting and deep plane facelifting is something I do every day in my practice. About 20 to 30% of all the patients I treat are revision patients who come from elsewhere. And previously I've worked in the cosmetic capitals of Los Angeles and New York before my practice in London. So in terms of this information that I'm talking to you about today, well, no information in this form can constitute a medical consultation, and really each kind of procedure, particularly facelift surgery, needs to be taken on an individual basis and customized to each person individually. So what is a deep plane facelift? Well, first of all, we need to look at kind of what is facial aging and how can facial aging be remedied or rejuvenated. So if we start by looking at a case study, well, this is a patient who presented to me with, well, significant jowls, and by that it means soft tissues come down with gravity, creating this fullness along the jawline. And in a way, there's also sagging of the skin, loose skin. There's loss of the nice sharp angle in the neck, and sometimes this is rather unflatteringly described as a turkey neck. And there's also like loose skin in the neck area and around the jawline. And ideally, we want like a procedure that's going to be natural. It's going to rejuvenate the face to where it began, and that means lifting things in the direction in which they've dropped against gravity. Let's have another look at a different patient. Well, this patient has very deep nasolabial grooves, and these are lines that go from the nose downwards towards the jawline. In addition to that, there's also like soft tissue along the jawline, and loss of that natural smooth and even jawline, and the fullness in the neck, which is partly loose skin, it's partly the soft tissues beneath the skin, and then just a slightly kind of tired appearance. So is a deep plane facelift better than a standard facelift? Well, what deep plane facelift surgery means is lifting the deeper soft tissues to where they began. So it's very much a vertical lift in direction. The short answer to this, in my opinion, is yes, it is a more natural facelift in that it's lifting things back to where they started. It recreates the youthful V-shaped jawline. Now with aging, your jawline becomes squarer as areas drop down with gravity, and lifting things back to where they started, which is what deep plane facelifting does, recreates that V-shaped jawline. So if we look at this image, well, the case studies that we've looked at, we've seen how the volume of the cheek has dropped down, creating this fullness in the jowl area, fullness in the neck. So a deep plane facelift lifts this back up and restores the anatomy to where it used to be. And by doing that, it's natural, it improves and softens those lines that we looked at, recreates a more V-shaped jawline, and beautifies the face. Now it does differ from a standard facelift, where that tends to be lifting more towards the ear, which does make a difference, but it doesn't restore the natural volume to where it used to be. The technique is more challenging, and only a small proportion of surgeons truly conduct deep plane facelifting. It does take more time, and sometimes it requires additional procedures in order to get the best results, because if you have a lot of loose skin and everything is lifted up, well, that loose skin may mean that you need to do something around the brow area, like lifting the brow, just to take away some of that loose skin to give the best result. So, secondly, am I an ideal candidate for a deep plane facelift? Well, ideally for this kind of procedure, you do need significant facial aging. Now, if you only have mild changes, a mini facelift technique or a technique focusing on addressing the mild laxity in skin, well, those techniques are going to be preferred. But if you have significant facial aging, and that's going to be towards the age from 40 to 60 onwards, and that means like sagging skin, a drop of volume with gravity, jowls, and of course you're in good health. And yes, there will be some recovery in terms of swelling, and it's important to be realistic about the expectations from that. Other things, well, in terms of smoking, well, that's a complete no for generally this kind of surgery, because you're going to heal slower and there's more potential issues with healing of the skin and the scars. So things like good health and absence of smoking for at least a period is definitely going to help you. How long does this procedure take? Well, any procedure needs to be balanced about in terms of what is required and what the recovery will be. So generally a deep plane facelift, well, it's a procedure that's going to take 3 to 5 hours, and it's really difficult to have a procedure that's going to be less than that, because what is required during the procedure. And often, well, there are going to be other factors that need to be taken into consideration. A common thing might be, well, you might have lost some volume, and rather than using fillers, well, we can use your own fat in terms of fat transfer, and that will restore more natural volume to your face. There could be other things such as resurfacing the skin with a laser that will polish the skin and improve with the fine lines and enlarged pores. So these procedures are often used in conjunction with deep plane facelift and give the best results. What is the recovery? Well, generally I advise patients that 80% of the swelling will go between 2 and 6 weeks. And generally you need a good 3 weeks for most recovery and most swelling to occur. Now, some patients can look really good even after 1 or 2 weeks, and that's great, and that's fortunate for those patients. But then other patients can naturally have a bit more swelling, and that can be sometimes more towards 6 weeks. And so for most people, I advise you to have 3 weeks in terms of recovery. But if you have something really important, like an important event, an important birthday or wedding, then I would say definitely have 6 weeks just in case. And like all things in life, some people will heal really quickly, and some people can take a bit longer, and you can have a bit more swelling. And there are things that we can do in terms of medicine. There are medications, there are techniques such as lymphatic drainage, there are things that we can do to speed up healing, but you have to allow for swelling, because swelling can be the main thing with healing. Now, there are other things like the anesthetic. Well, in my experience, using sedation, that's much milder than using general anesthetic, and that speeds up recovery, reduces your chance of bruising, reduces the swelling. And there are other things like that can be done after the surgery, such as lymphatic drainage, and I often work alongside specialists who are able to provide those kind of treatments routinely for my patients. What is the cost? Well, the cost for a deep plane facelift in the UK is going to be from about £15,000, and it's going to vary a little bit depending on the location, the facility, and if you needed associated techniques to give the very best results. Now, it does take quite a lot of years of training and experience to provide this procedure, and it's a longer procedure. It's a procedure that, as we talked about, takes several hours. The quickest facelift procedure, well, it can be done in an hour and a half, but it's not going to be like a true facelift, and it's not going to reflect in the results. And one way of looking at it is an investment. My personal signature techniques, well, it uses a variety of the things we've been talking about, and certainly deep plane facelifting, I believe that this gives patients better results, and certainly in the past I've offered patients other procedures along SMAS lifting and mini facelift surgery, but deep plane facelifting, when combined with these procedures, gives a more natural lift and beautification of the face. Quite often, I will also look to add additional procedures to give the best results. But really, with this kind of procedure, even at 24 hours, you see an improvement in your jawline, in your neck, and a more V-shaped face. And patients are often very happy even at this early point. Now, sometimes additional procedures such as augmentation of the chin with a chin implant, and patients have a very full jawline and neck, Well, sometimes they can require more advanced techniques such as shaving down the deeper fat, shaving down the deeper soft tissues, which include sometimes the salivary glands that have dropped down beneath the jawline. Now, in those patients, the salivary glands are not removed, but they are reshaped in order to contour the neck and give a better result. I apply principles such as the golden ratio that looks at the relative proportions of each individual's face to give the best possible results. And often there are other techniques such as adding volume, fat transfer, that just make each result that little bit better and longer lasting. So in summary, well, we've talked about the 7 frequently asked questions about deep plane facelifting. And those include what a deep plane facelift is it better, who makes a good candidate, what is the recovery time, what is the cost, and ultimately, what is the best result can very much depend on your individual needs. What's the best facelift for me? Well, you certainly need to research this. You need to look for a specialist who's completing this kind of surgery every day. With this kind of surgery, 50% is kind of technical detail, and the other 50% is a kind of artistry, because there's no absolute measurement in the face and neck. 2 millimeters is going to be a perfect answer. It requires a degree of artistry to give every patient the best result. I hope that this information has been useful for you, and if you have any other follow-up questions or you'd like to seek my advice in any way, then please follow this link, message me, and sign up for my newsletter.